Treatment planning in pediatric dentistry. What's the difference between adult teeth treatment planning and pediatric or baby teeth treatment planning? I'm Dr. Olga Dolghier. I'm board certified pediatric dentist and laser dentist here at Palm Valley Pediatric Dentistry and Orthodontics. There is a big difference between baby teeth and adult teeth. Baby teeth, sometimes enamel is thinner. We see a lot of bottle or nursing decay in kids, and sometimes treatment plan kind of more aggressive than adult dentists would do. We don't watch, we treat, because we know that little cavity will become big cavity quick because enamel is thin and tooth will decay faster than adult tooth. So what type of tools we use and what the levels of treatment planning? It depends on the child's age and the amount of decay. Also depends on the child temper, child behavior, child medical status, the underlying medical condition. So less invasive and number one step in pediatric dental treatment planning is SDF. SDF is Silver Diamine Fluoride. What it is, it's a combination of silver and fluoride combined. It's a liquid. So if I see an 18 months baby, mom was nursing or feeding bottle on demand that baby after the teeth came in, and now I see them and I see 4 front teeth, big cavities, what am I gonna do? First step, I will most likely use SDF to stop progression of the decay, because I cannot put 18 months old to sleep to fix the problem. Of course, I'm gonna have educational appointment telling mom why this is happening to the baby. So first step, SDF, we apply liquid. We do it usually 2 weeks apart, one application, 2 weeks later, another application, and it stabilizes the decay. It actually mineralizes the teeth, and the cavities actually from brownish, yellowish color become black. Not a nice picture, but front teeth will be completely black if there's cavities on every single surface. If it's 1 or 2 spots, it's just going to be 1 or 2 black spots. But if it's multiple surfaces, it's going to be black teeth. But what it does is actually brings silver. Silver kills the bacteria which cause cavity. Fluoride mineralizes the teeth, and when I touch the tooth structure, it's not soft anymore, because cavities are actually soft. Believe it or not, if I take a little spoon and spoon the cavity, it comes off. It's soft. And when I put SDF on, it becomes hard as a rock. So it's a good thing that the tooth are mineralize and become hard. And now I'm going to maintain this baby until they reach the point when I can actually do permanent treatment. What type of permanent treatments are available for that young kid? So if that's multiple surfaces of the teeth are affected, for the front teeth we do white crowns. There is different type of crowns. In my practice we use zirconia crown. Zirconia crown is a special material similar to porcelain, which is very strong, as strong as a metal, a little bit difficult to place, requires a lot of tooth reduction, but it have very nice aesthetic results, very good for your gums. Actually, you don't get much plaque buildup around that. Nice results, permanent restoration until duration of the tooth life, and then normally exfoliate crown with the tooth when it's time to come out when child is 8. For back teeth, if we have small cavity, then we would do probably just a filling. If the tooth has 1, 2, or 3 surface decay, we fill it with fillings. There is different materials, and we use composite materials, which is photopolymer. We use light, and it makes the filling hard, or glass ionomers. Some practices use glass ionomers. Advantage, it does kill the bacteria which cause cavities. Negative effect, it does release fluoride, and sometimes it kind of washes out with time. It's water soluble. Another good restoration is stainless steel crown. So if the tooth has multiple cavities on every single surface or 3 surfaces, we usually crown back teeth with stainless steel crown. There's actually 95% and higher of success rate of stainless steel crowns. It's placed on and it's done until the tooth comes out. Really good results with that. If the child experiences pain and the tooth already kind of bugging your kid when they're eating something sweet or hot or cold, but there is no swelling, there is no any other symptoms, they can sleep at night without medicine, then I most likely will have to do pulpotomy. Pulpotomy is when I open up the tooth inside, look at the nerve. I actually remove partially the nerve, not the root canal when the whole nerve is removed, just partially. Then we stop the bleeding inside, put a special medication we call MTA, which actually very good medication. It kind of stabilizes the tip of the root with the nerves and actually doesn't kill that remaining of the nerve. And then we fill up with a special material and crown the tooth on top with stainless steel or zirconia crowns. We do have white zirconia crowns in the back. Zirconia crowns are good, but it's not my favorite for the back teeth. They're very challenging to place, and we found that it requires a lot of more tooth reduction than stainless steel. So for me, I love stainless steel crowns in the back because I know if it's done, it's done. There's no problems. White crowns, most of the time they're fine, but once in a while we'll have problem with that. And if your child swell up, Johnny woke up this morning with a swollen face, and you look inside the mouth and you don't see anything, or you see the tooth with a big cavity or large filling, then most likely Johnny has a dental infection. What do we do? It's a primary tooth, that's a good news. So what we do, we remove the tooth, extraction. And if it's the first molar or second molars, then we have first adult molars, and then most likely we're going to put some type of space maintenance. For first molars extractions, we do band and loop space maintenance. It's a small band goes around your back tooth and kind of extends to the canine and hold the space open until that growing up tooth is ready to go up. They sometimes have to be in the mouth for multiple years. For example, first molars average age for eruption is 9. So if Johnny lost his tooth at the age of 5, that's going to be 4 years with a space maintainer. Sometimes we do big retainers, which we call lingualized holding arch or Nance appliance for the top 4 second molars. Those are good maintainers as well. So pediatrics technically has steps. So lightest is less invasive, is your SDF, then filling, then nerve treatment, stainless steel crown, last resort extraction, and a space maintainer. So that's how we treat primary teeth. If we have a child with adult tooth cavities, then sometimes we do prevention. Prevention is the key, as I always say. So we often do sealants. What sealants are is a special protective coating for the back molars. What it does, instead of deep grooves, it makes them shallow. So we seal all the grooves in the hope that your child is brushing and flossing, has good oral hygiene, eating and drinking good foods, and then they won't develop cavity on those teeth. So it's part of your prevention measures. So sealants are very commonly done, and it's done on your 6-year-old molars and 12-year-old molars, sometimes premolars we seal. Baby teeth very rarely we seal, but only in the kids who have very extremely deep grooves also. Also, part of pediatric dentistry is behavior management. It's not that we don't want to do a filling with just a laughing gas for every single kid, or just a filling with no any kind of anesthesia. We wish every single kid behave beautifully, sit in a chair still, and have no issues. But unfortunately, reality is different. The kids go through different stages of development. They have different tempers. So some are extremely shy and easy to manage. Some are more anxious, and some of them are very sensitive. I took a lecture recently, and the lecture divided most of the kids on 2 big groups. One are dandelions, and another one was orchids. So kid who is orchid, very, very anxious, needs a perfect environment to survive. Those are difficult patients to manage. And dandelions are the ones who can handle anything technically, no matter what environments, they still do fine. So kids have completely different tempers, different stages of development, and we treat them according to type of temper, according to what your kid needs and what they can do or cannot. They have to have either just injection and a filling, for example, with no anesthesia. Then first step would be laughing gas if your kid is pretty well behaved, just anxious. And if they are very anxious and this kind of older kids have good airways and need a lot of dental work, we might sedate them with oral sedation or put them completely to sleep. It all depends on so many different factors. So pediatric dentistry is very complex, has a lot of different ways of treating one simple cavity and so many different ways to manage your kid's behavior. So share with me, let me know what type of experience did you have? Do you have dandelion child or do you have orchid child? I want to know. Thank you so much for watching. Cannot wait for your comments. See you in next video.